The director of the National Institutes of Health is set to face some tough questions on Capitol Hill today over the proposed budget cuts that they want to implement at NIH, slashing the budget potentially by 43%, which means programs and research. Just a day before this testimony, more than 300 NIH employees published a letter addressed to the director, Dr. Jay Bhattacharya, called the Bethesda Declaration, speaking out against what they say are these new policies undermining the NIH mission and harming public health. CNN's Meg Terrell has more.
The NIH employees are calling this the Bethesda Declaration after the location of the headquarters of the National Institutes of Health in Maryland. And they're modeling it after something called the Great Barrington Declaration, which was a piece of writing that really sort of brought the current director of the NIH, Dr. Jay Bhattacharya, to national prominence. This was a piece of writing he put out with colleagues in October of 2020 during the COVID-19 pandemic that espoused a sort of contrarian approach to protecting the most vulnerable while loosening up restrictions on those who were less vulnerable to COVID-19. Now, that was seen as a dangerous approach at the time by many before we had a vaccine. But at any rate, this is what they're modeling their dissent on, saying essentially that they appreciate the director's openness to not suppressing different scientific ideas. Now, what they're taking issue with here is the termination of a number of grants in different areas, from health equity to the effect of climate change on health, COVID-19, and other areas, as well as a number of other policies they say are damaging the NIH and keeping it from fulfilling its mission of improving health both in the United States and around the world. In the letter, they say that the administration, quote, has forced NIH under Bhattacharya's watch to politicize research by halting high-quality, peer-reviewed grants and contracts. Academic freedom, they say, should not be applied selectively based on political ideology. Now, the NIH responding to this, telling us in a statement from Bhattacharya, quote, the Bethesda Declaration has some fundamental misconceptions about the policy directions the NIH has taken in recent months, including the continuing support of the NIH for international collaboration. Nevertheless, he says, respectful dissent in science is productive. We all want the NIH to succeed.
All right, Meg Terrell, thank you so much for that. Let's talk more about this dissent and what it means today. Joining us right now are two of the NIH employees who signed onto and helped organize this letter, Dr. Jenna Norton and Dr. Ian Morgan. Thank you both for joining me this morning. Dr. Norton, why did you decide to step forward so publicly? What was the last straw for you, if you will?
You know, I don't know that there was a last straw per se. There was just so much going on that was really against everything that I got into public health for. I mean, I came here to help people, and I was being asked to implement policies that were directly harming people, directly harming research participants, and directly harming broader public health in America and across the globe. And it was just completely counter to everything I stand for. And that's why I decided to speak up. Also, we weren't being heard when we voiced these concerns internally. And so this seemed like the only option to get these really harmful policies to come to an end.
And one thing that I notice in what you all lay out in this letter, Dr. Morgan, is something different than what we have heard from prior to now. I would say we often hear from those in public health of the concerns for what could happen with the changes that are being made at HHS. And what you all are describing are what is currently happening, harm that is currently being done by the cuts that are being made and the changes that are coming from the NIH director and the Secretary of Health and Human Services. What harm are you seeing, Dr. Morgan?
Yeah, thanks, Kate. And I just want to emphasize that both Jenna and I are here under our personal capacities and not representing the NIH. But to answer your question, I mean, due to the current administration and Director Bhattacharya's politicization and disruption of life-saving biomedical research, I've talked to researchers across the country and at the NIH. And right now, cancer patients are not receiving novel cancer treatments and are being cut off when their only other option is hospice care. And that is the harm that is ongoing right now. And that is the cost of what is going on due to this politicization of biomedical research.
How about you, Dr. Norton? What are you seeing? What is the harm that you are seeing that you think is going to continue with this?
Yeah, absolutely. And as Ian said, I am here in my personal capacity. And the harms that I'm seeing, though, in my role at NIH are trials where people have implanted devices inside their bodies being terminated with no safety protocol, no shutdown procedures. So participants are being left in the lurch, right? These research participants volunteered their time and their literal bodies, not for themselves, because when you participate in a research study, you don't necessarily benefit. You could be in the placebo arm. So these folks are making a hugely generous gift so that other people in the future can be healthier. And we are leaving them in the lurch. We are leaving them in a hugely risky position with no follow-up, no safety monitoring. And it's just completely counter to everything I got into public health for.
And Dr. Morgan, my colleague Meg Terrell read some of the response from the director, from Dr. Bhattacharya, about the Bethesda Declaration. And we also have a statement from a spokesperson for HHS, which also said the agency is, quote, actively working to remove ideological influence from the science process. And when projects have failed to meet these standards, they have been discontinued so we can redirect resources to rigorous, impactful science. What they are saying is in part that your dissent is misguided, that you are wrong. And you say what?
I mean, they're wrong. They're the ones politicizing and disrupting research. What is political about novel cancer treatments for cancer patients? Stuff that they're cutting right now.
And if I may add.
So,
go ahead.
Yes, Jenna?
Go ahead, John.
Apologies, sorry. I just want to add that I think, Bhattacharya said we had a fundamental misunderstanding of NIH policies, but I think he's got it backwards. Dr. Bhattacharya has a fundamental misconception of what is happening on the ground at NIH. And I think that is because he continues to not listen to the people who are operating NIH every single day. He is postponing meetings repeatedly with our leadership who have tried to raise these concerns. And he has not really given any outlet to hear from those of us. And what we see on the ground is not thoughtful review of research. It is keywords and phrases that this administration doesn't like that is causing studies to be terminated, right? So they're looking for specific words they find offensive, terminating research based on that, not based on the rigor or quality of the research.
Before you go, Dr. Morgan, I did want to also ask, when you hear someone say, if you don't like how they're running things, if you don't like the direction things are going, then leave NIH. This is what the president campaigned on. This is what he won on, and this is now what he says, how this agency is going to be run under the direction of RFK Jr. Dr. Morgan, respond to that.
I've been at the NIH on and off as a researcher for the last 15 years or so. And the NIH mission is just too important to let that die. I mean, right now, if you know someone out there who is suffering from cancer or Alzheimer's, right, and you have a hope for a cure, right now they're stealing your hope away from you. And our job at the NIH is to provide that hope. And I think the key here is that it's not too late. It's not too late at the NIH. It's not too late across the country to try to get that hope back. We can right this ship, and that's why we're staying at the NIH, to be able to do that.
Dr. Morgan, Dr. Norton, thank you both for coming in this morning and speaking up. We often hear the administration criticize those who speak out anonymously, and you are absolutely not speaking out anonymously, putting your faces, names, and careers on the line here. Thank you both very much.